Namaste. Myself Dr. Purnima Avinash Patil, an ophthalmologist from Davangere. This is an attempt by we the members of Davangere Ophthalmic Association to create an awareness regarding emergency eye care and ocular conditions that needs immediate intervention in this lockdown situation due to coronavirus pandemic. Karma says you will never understand the damage you did to someone until the same thing is done to you. Knowingly or unknowingly, human beings have caused greatest damage to Mother Nature. Here we are, facing the consequences. Let us all face the situation boldly. Here are some precautions to be taken while you visit hospital for your own safety and for the treating doctor's safety. Visit hospital only in case of real emergency. If you feel it is really necessary, then get only one attender along with you for your own assistance. Prefer to come by your personal vehicle. Cover your nose and mouth with a mask. If any of your family members are under quarantine, directly visit government hospital or please inform about the same history to your treating doctor so that necessary precautions can be taken. If you are having cold, cough, fever, breathlessness, then directly visit government hospital, fever clinic, as the necessary safety measures are not available at private clinic. Now, let us know about relation between corona and eye by Dr. Shantala.
Thank you, Dr. Purnima. I am Dr. Shantala Arun Kumar. I will share with you about coronavirus and the eyes. Corona is a highly contagious virus and can affect the eyes. It can possibly be transmitted by aerosol contact with conjunctiva. That is, when a COVID-19 patient coughs or sneezes, these droplets accumulate on the membranous surface of the eye, and secondly, making contact with the surface or object that has the virus and then touching the eyes causes infection. Reports suggest that virus is present in eye fluids and can cause a mild follicular conjunctivitis or pink eye. That means it can spread via people's tears and rubbing the infected eye and then touching someone else. Such patients should take appropriate care for proper diagnosis and prevention of transmission. Therefore, it is very important to take care of your eyes by wearing protective goggles when you leave home. Do not touch your eyes with soiled hands. Wash your hands frequently. Take care and stay safe at home. Dr. Rashmi, the impression is that the emergencies for ophthalmologists are less as compared. What is your opinion in this regard?
Thank you, Dr. Shantala. I am Dr. Rashmi. I shall be briefing you few ocular conditions which need immediate care and attention. Most commonly encountered eye problem these days is conjunctivitis or infection of the white part of the eye. A person affected manifests with redness, swelling of the eyelids, watering and discharge. As this is contagious, please see your eye specialist. Sudden loss of vision or diminution of existing vision is usually due to retinal problems. Don't wait for the lockdown to unlock. Rather, see the doctor immediately. Patients already diagnosed with retinal problems like diabetic or hypertensive retinopathy should never forego their follow-up visits. Treatment in the form of lasers or intravitreal injection should be continued as advised. Ocular injury is always an emergency. Whether it is the foreign body in the eye or trauma with blunt or sharp objects, there is no room for postponement. Few get well with topical medications and few may need surgical intervention. Itching, dryness in the eye, non-specific redness, headache, present since long is not at all an emergency. Wait until the situation clears. We are just a phone call away. Call us for the advice. We are always at your service and is our duty too. But please think twice before stepping out. Here are few tips on the treatment and follow-up visits for glaucoma patients by Dr. Anita Maya. Thank you.
Thank you, Dr. Rashmi. I am Dr. Anita and I will give a few instructions to be followed by glaucoma patients during this lockdown period. I would advise all patients who are currently under treatment for glaucoma to continue using their eye drops as advised by the treating ophthalmologist. In case the eye drops get over, they can visit the nearest medical store and purchase the same. Follow-up visits can be postponed until after the lockdown period. Similarly, patients who have undergone glaucoma surgeries or other eye surgeries can use all the medications and follow the post-op instructions as detailed in their discharge summaries and stay safely at home. In case any doubts were to arise, they can contact the ophthalmologist through phone and clear the same. If any of the patients notice a sudden onset of redness of eyes, pain or swelling of the eyes, or a sudden reduction in vision, then they definitely need to consult an ophthalmologist at the earliest. To protect yourself and your family from corona, stay home and stay safe. I now request Dr. Meghna Patil to tell you all about corneal emergencies.
Thank you, Dr. Anita. Hello everyone, I am Dr. Meghna Patil and I would like to discuss few corneal conditions which can be taken care of while you stay at home. First, dry eye syndrome. Using electronic gadgets for longer hours can cause dryness in the eyes, leading to eye pain, redness and eye irritation. So let's limit the time spent on these gadgets to just 3 to 4 hours and follow 20-20-20 rule. After every 20 minutes, close your eyes for 20 seconds and then look 20 feet far away. Second, calotropis injury. Try avoiding calotropis flowers when you worship, as the latex of this flower can cause severe corneal damage and sudden drop in vision. Third, contact lens infections. As you spend a lot of time indoors, avoid using contact lens regularly and switch to your old glasses. If contact lenses are not maintained properly, it can cause corneal infections. Avoid frequent eye rubbing. Stay home, stay safe. Thank you. Now, Dr. Renuka Barki will brief you on pediatric eye problems.
Thank you, Dr. Meghna. Myself, Dr. Renuka Barki, ophthalmologist, Davangere. It's natural for parents to become anxious when children are not feeling well. What if something happens to their eyes or if they notice some eye problem? Well, don't get panic because it's not that all eye problems need emergency care at this present situation of lockdown. For example, cataract, squint, lid problems or your appointment for glass checkup can always be postponed till lockdown period gets over. But there are some situations like discharge from eyes, redness or swelling of the eyes or any kind of trauma to the eye which need emergency care. So immediately consult your ophthalmologist. As children are at home during this lockdown period, there are more chances of injury to the eye. So make sure that children play under supervision of parents. Any kind of sharp objects should be kept away from the children. If needed, use protective glasses. Be careful with accidental fall of clay or fevistick to the eye as children use them for their craft works. Discourage children from using mobile phones by engaging them in other activities. Prevention is better than cure. So let's be at home and be safe. Thank you.